Welcome, everybody. My name is Lauren Kopsick, and I'm really excited to be here with at least more than one of you because I wasn't sure if anybody was going to come to listen to our talk about your mental health toolbox, which is part of a universal, interactive, and immersive nonprofit program called the Healthcare Navigation Project, where we focus 100% on health literacy and life skills at the grassroots level up, not policy down. We want you to have an understanding of trusted resources that you can get to before you need it instead of after when it's too late. And we do that by nurturing your natural abilities. The fancy word is life skills, or my favorite is street smart, all through teachable situations. We don't use workbooks in our program because I know I'm a marketing person and I'm going to take 2 or 3 of something and I'm going to plan to read it and share one with you, and somehow 3 months from now it's going under my bed when company is coming, right? Now I have to change this. I have a sociology degree in juvenile justice, and I ran an outbound telephone call center, which is why I also believe all people need to understand and learn body language and telephone skills. I was also a banker with Chase with what would be $800,000 in secured lending authority. And I've been in corporate marketing, training, and development, and that's where I feel we're missing the dog and pony show, if anybody knows what the dog and pony show is, right? So nobody's giving it to us, we, the people that sometimes also happen to be patients. I'm also a small business consultant, and I co-founded an adult pediatric support group for the Crohn's Foundation in Richmond, Virginia. But I'm the most proud to say that I'm a mom to 2 man boys. The older one is neurodivergent or on the spectrum, and the younger one has 2 rare diseases since age 11. My story is in 2015, we were turned away from my son's treatment of a biologic called Remicade. Because of something that I've learned since, are words called step therapy. After an exhausting 16-week education and all of this to get it overridden, while my son missed an entire treatment and ended up with that second disease diagnosis as a result, I realized that there was no way that my kids, your kids, or anybody was going to be able to navigate anything like this, but I knew already, and I decided that was it. I had to share what I knew. So I spent 7 years talking to all different socioeconomic and age groups to understand what people don't know that they don't know, et cetera, and here we are. And it turns out that everyone can navigate their health and basically life by nurturing the skills you already have. So this is an interactive program. So I want to show you what I mean about nurturing your natural abilities. So I mentioned to you that I'm a small business consultant. Who here in the audience is also a business consultant? Oh, this is going to be good. All right. So, so in this example, you all are small business consultants and I'm your client. And like most small businesses, I have no money. I have no money to market my product, but I have money to pay you. Not a lot, but I have some. And so I come to you and I say, I have this amazing cupcake. It's different than any other cupcake you've ever had, but I have no money to market it. My question to all of you is, what kinds of things could you think of to offer me that you could do to market my cupcake that wouldn't cost any money? And once you think of something, you can just raise your hand. No, I just want, you can put it down because I know you raised it, but We're not talking about it. I just wanted to know first if anybody had thought of anything. You're just waving, right? You're not thinking? Okay. Well, if you were thinking of, and if you were not thinking of something to do with the words social media, then put your hand down, because that was too easy. I want you to think, what are things that you could offer me that wouldn't cost anything, that could market my product? Are you thinking? Okay. Well, the whole idea of this was really not the answers, although I'll give you some tips in a minute, but hopefully the feeling that you had in the back of your brain as you were trying to think of something to match up with what I said. So that connection from your long-term memory into what I'm saying now is what we're looking for. And that takes practice, right? So did anybody feel that feeling while you were trying to think? So that if you weren't, then you probably weren't trying to think. But if you try to think, you know what I'm saying? Okay. So before we start, there are 5, I don't have a slide for it because I decided at the last minute you needed to know the 4 others. I'm gonna share one, but I'm gonna tell you about all of them. So there are 5 principles to self-advocacy, in my opinion. The first one is people are people. And what do I mean by that? People have different personalities. They might not know exactly what they're saying. I am so sorry, I just got lost in my thoughts. People are people, good, bad, and indifferent. It's not misinformation. It could be misinformation, right? And not disinformation that you're hearing when you talk to different people and you're asking questions. So the second is, if something doesn't make sense to you, you don't stop until it makes sense. Why? Because we just said people are people, and they're not always going to have the answer. And especially if it's something about the word HIPAA, they're not going to tell you anything, right? So that's the second. The third one is we work from the outside in. And people didn't understand what I was saying a few years back, but most of you know now we have very large hospital systems. So during open enrollment, especially this year, it's important that people understand that they should be researching the hospitals that are part of the systems that they will be in. Because I know of a lot of people that are surprised now that they're not going to the hospital that they thought. So you need to work backwards. You find the hospital and then find the doctors that work within that hospital. Another one is don't give up anything, because you'll never, ever, ever get it back. And you probably all know what I'm talking about. But also, as far as accommodations at work or school or anything. And lastly, it's research, and more research. And we're going to talk about that today. Oops. Okay. Okay. We're hoping when you leave, so you don't need to know the 5 principles, those are just extra stuff, is that you can explain what the new definition of health literacy looks like, that you can describe a coping technique that you could use, and you can share 3 pieces of information that you're going to learn from a trusted and confidential resource. So we'll answer the first one first. Every 10 years, the CDC comes out with what's called Healthy People. So there was a Healthy People 2000, 2010. Now we did 2020 for 2030. And what's interesting to me is the word use is now added to the definition. Never before was the word use in there, which I find really incredible, because how is it that what's the point of having your health insurance if you don't know how to use it, right? So now it's the ability to understand find, and actually use your health care, and to be able to know it well enough to make informed decisions for yourself and other people. The second thing, which is very interesting in 2020, for the first time ever, we see organizations now responsible for this as well. And I forgot to tell you, because I created something that didn't exist, I used pieces of it that were already approved, so I had credibility. So that's why these pieces are. Honestly, I made up this program and then somebody told me I needed to get statistics, and then I found out they're on my team, right? So as of 2020, you may have known that now you're getting health and wellness training, because that is now a responsibility for all organizations. But they added 2 words. They not only have use, but the word equitably is also in their definition. And they don't say employees, they say individuals. So what I'd like to think that that means is everybody that works at your company, not just the full-time people, or not just the full-time people that even have your insurance. Anybody, part-time, janitorial staff, whatever, everyone deserves the right to understand how to actually use their health care. Okay. Now this is the part where we're really getting into the mental health piece. So the other piece that we use is the World Health Organization, in collaboration with UNICEF and everybody else, decided there's 3 main categories of life skills that you need, or we need, for global mental health. And the first one is critical thinking and decision-making skills, which we just did an exercise in, although you guys didn't come up with something, expanding and nurturing your thinking skills. The second one is interpersonal and communication skills, and then coping and self-management. So we already went over thinking and decision-making, so we are going to talk about communication skills. There's evidence to suggest that your brain prioritizes nonverbal communication over verbal communication when it's confused. So, for example, I say to you, I love all of you, I really do. So your brain just saw me literally hug you and hold my heart at the same time. And if it didn't see me, you heard audio that I had a sincere tone to my voice. So your brain is not confused. You know I love you. But what if instead I went like this? I love you. Of course I do. So now what did you see? You saw me shrug. What does that mean, right? It's like, whatever. But if I didn't see that, I heard you with not a very sincere, it was like a whatever kind of a voice, right? So now my brain's going to say, you didn't mean that, Lauren. You don't love me because of what we just said. So your brain will prioritize that. But there's also nuances you have to understand. There's cultural differences in the way people, right? And also, I have a son I mentioned that's neurodivergent. So I'm neurotypical. So if I'm going like this, it's because I'm bored. But if my son or a neurodivergent person was doing this, it's because they're trying to calm themselves or focus in. So it's, what I always tell people is go to a park and not be stalkerish, but just observe people and their body language and all of that. And you can expand your thinking skills that way too. Now, I am going way off my cards here. Okay. So we're going to spend the rest of the time here. We have plenty of time. Okay, coping and self-management. I'm going to give you 2 problem-focused coping techniques that you can bring home with you and share with anybody and everybody, I hope. So, problem-focused coping strategies. That's where your brain, I apologize. That's where your brain, the internal part of your brain, is responsible for feeling like it can change the world, basically. But problem-focused coping strategies, if you're dealing with a problem, rather than dealing with it because you're not dealing with it, there's something called chunking, which is where you take a problem that's immediate and you break it up into smaller pieces that are more manageable for you, right? So I like to use, and I tell everybody about it, I call it the folder method or the file method and the what I'm afraid of folder. So this is how it works. You know all those things on your head that you're thinking about now that you were supposed to have done or you don't want to do, but it's still there even though you're here this week, so you were thinking, I'm here so I don't have to think about it? All those things, write down someplace while you're here. Rip a piece of paper, go take a napkin, get it out of your head and on a scrap piece of paper. And when you get home, or if you have one in your room, you take a folder, an envelope. It doesn't have to be a folder, anything that closes, and you could write on it. But you have to write the words, what I am afraid of. And the reason why it has to be those words is something is stopping you from doing this, right? So whatever it is, we can only assume we're afraid of it. Otherwise, we would have done it already. So you do this and you put it away someplace where you know where it is, but you don't have to deal with it. And now let's say it's 3 months or 4 months or a week or whatever down the road, and you wake up on a random Tuesday and you're like, oh, I feel really good today. I'm going to go over and see what's inside that folder because I think I could deal with something in there. And let's say you open it up and you're triggered by the first thing you see, you shut it and walk away. That's not the point of this. But the good news is you already saw what was in there. So the next time you come, you're not going to be triggered anymore. Not to say you won't be triggered by another thing and need to close it, but let's assume you get through that. Then you can go find something in there that's easy to tackle. And that's why I also say put little things in there, because maybe you don't want to do all these big things at once. You want to work your way up. But I can tell you that once you do whatever it was in that folder and you have that piece of paper and you're able to rip it up or crumple it and throw it away, it is the most freeing experience you've ever felt. And I'm going to tell you about one story that, I don't know, epitomizes what this is all about. So a 25-year-old boy wrote me an email because he was so proud of himself because he's been using this method. And he said, I hadn't paid my taxes ever. That was in his folder. I felt so bad for him. He said, I took my stuff down to H&R Block, and it turned out because he also didn't pay taxes during COVID, any monies that were coming back to people, he also didn't get. So in the end, I don't know if he got $1 back or he owed $1, but it really wasn't such a big deal for him. He was so elated, he couldn't wait to tell me about it. And that's usually what happens, as we know. When we finally deal with something, right, it's not as bad as what we thought it was. But it really is a great tool to use. I use it with my family members, my 2 boys actually, and we, when we're done, we'll say, oh, guess what we did, that kind of thing. So that's one. And I have to do it here. Oops, Whoop, we're going the wrong way. Okay. The fifth principle of navigating your healthcare was research, research, and more research. So if we look at a nonprofit as a trusted resource, right? A nonprofit is a trusted resource that you can use to research. My son, I needed to keep him on his father's insurance past age 26. I called 5 nonprofits and nobody could help me. I figured that one out by myself, and it is on our resource page if you want to. I have a bunch of stuff on the resource page of our nonprofit. But anyhow, I'm going to find my slide, my notes here, because I am. So you can call different nonprofits and do research and find out information, right? You know, they're in business for giving away information, money, products, resources. I actually have one on my website. They are pilots that volunteer their time and planes that are donated, and they can bring you wherever you need to go. And it doesn't have to just be the patient, they said. It could be a family member that wanted to see that person. So there's all kinds of nonprofits out there that do all kinds of things for people. But let's say you don't know where to begin, or you don't have time for hours of research, or it's 3 a.m. and you just want to talk to somebody other than a sick parent or a child or yourself. What if there's a language barrier, or you're afraid ICE might come, or any of the millions of reasons not to? You can call my favorite nonprofit in the world, which is 211. Who here knows what 211 is? Who here has ever called 211? Awesome. Who thinks you just call, well, you guys don't know what it is, but if you did, who thinks you just call it if it's a crisis or an emergency? Do you know 988? Have you heard of 988? Have you called them? Would you think you just call them if it's a crisis? So, 211 is the keeper of every resource in your state. And you can call any state and get anybody's 211. You can call 211 right now and you'll get it'll be right here, which is what we're going to do soon. What we do in this program, which is different, is we make live phone calls. Because like I said, I'm a marketing person and I'm not going to read anything. I'm also not going to call. I'll want to call. I'll mean to call, but I won't have time for it. So if I call 211 with you on speaker and you can hear all the different things they offer, it's going to change. It'll be life-changing. Wouldn't you agree, the people that have called 211, that they do things that you have no idea that they do? But your clients or patients can call them. And that's the best part about this, because they're what's called a warm line. A warm line is somebody that's a trained support person. It's not like calling the doctor's office and then you're just getting a person on the phone. But you're going to get a trained support person. And in a lot of cases, because I've spoken to several states at this point, they answer for 988 and 211. And 988 is the suicide hotline. So you can call 211 and talk about anything you want. They're open 365 days a year, 24/7, and they want you to call them. So I thought, rather than telling you and then you're not going to call, that we would, because we have plenty of time, call them and ask them things like, well, I have a whole script, but I don't know that you need a script with a warm line, because they're trained support people. But I can tell you here in New Orleans, I tried to call 211, but I also have called them when I was in Virginia using their regular number. And when I called 211, it went through a whole, if you have this, if you have that, if you have, this whole press this. But when I call the regular number, it goes pretty much right through. So we're going to call the regular, with the area code and all of that. And just understand, you might want to try both if you're going to, show somebody else so that you get to the person quicker. Because if it takes too long to get to a person, you're not going to wait, in my opinion. So we have 2 microphones here. So I would love if you have questions that you would like to ask of them and what resources they can offer. You're more than welcome once we hear from them what they do. I've only done this with kids and then teachers or like nurse practitioners, and so this is my first, just like a bunch of adults. So I hope you get something out of this.
For calling 232 HELP, Louisiana 211. If you are in immediate danger, please hang up and dial 911 now. Please stay on the line, and a live agent will be with you shortly. This call may be monitored for quality or training purposes.
Press 1 to receive information about COVID-19 and monkeypox. Press 2 if you are providing care to a relative child and would like information about resources for kinship caregivers and their families. Press 8 to speak with a live specialist about resources in your area.
All agents are...
Thank you for calling 232 HELP, Louisiana 211. My name is Courtney. May I ask who I'm speaking with?
Hi, Courtney. My name is Lauren, and I run a nonprofit called the Healthcare Navigation Project, in which we talk about mental health and how wonderful 211 is. And I'm with a group of people on speaker because only 2 of them know who you were, and I feel it's really important that everyone understand what you all have to offer. So I was hoping you could tell us.
Okay. So we are an information and referral service. Our mission is to connect people to the different kinds of resources that are available within their community.
Could you give us the long version? Like, what are things that people don't know that they don't, that they don't know that you do? Like, I know, at least in Connecticut, they give you free tax help. There's just all kinds of different services. Could you mention some of those that are more unusual?
Right. So we do have a program, a similar program that offers like tax assistance at the beginning of the year. We provide referrals to Goodwill and Salvation Army for like clothing vouchers or household item vouchers. I can't really think of anything else offhand, but those are a couple of examples. Some examples of some of the resources that we have are like resources for rent assistance, utility assistance locating food pantries, homeless shelters, things like that.
But also, what if you don't know, let's say you're confused about a career, you want career counseling. I thought you also could refer people to all of that and like finding a job and resources for that and career counseling.
Right. We may have some resources that assist with that as well. And the list that I gave you is not exclusive. Those are just some examples of the kinds of resources that we have.
Okay. And when are you open?
Our services are available 24/7.
Thank you. Thank you so much. It's been a wonderful conversation. Thank you for your time.
You're very welcome. Thank you for calling 232 Help.
Okay, bye-bye now. So that was the information line, but if you notice, there was another line that talked about families and children. So if you don't mind, because we have time, because the other thing about people being people is sometimes you get somebody that knows everything, and sometimes you won't get somebody that knows everything. So I just say you speak to the person, and then if you need more information, you just call back and somebody else will answer if it's customer care, if it's anything. So I'm going to call back, and I want to say the one
For calling
what I did the other day.
Louisiana 211. If you are in immediate danger, please hang up and dial 911 now.
So it'd be two that we're going to pick.
Please stay on the line, and a live agent will be with you shortly. This call may be monitored for quality or training purposes.
Press 1 to receive information about COVID-19 and monkeypox. Press 2 if you are providing care to a relative child and would like information about resources for kinship caregivers and their families.
All agents are currently assisting other customers. There are currently 0 callers ahead of you.
The one in Massachusetts had like 15 different prompts before you got to speak to somebody. It used to be when I first started calling them, a live person would just pick up.
Your call is important to us. Please continue to hold for the next available agent. All agents are currently assisting other customers. There are currently 0 callers ahead of you.
Sorry. Only because I'm doing this here. Usually somebody's on the phone and they give you all kinds of information. While we're waiting, I called the one in Virginia with a couple who had told me that their grandmother, was needing food and she was lonely and she lived in a different state. And she didn't know about 211, and we called and we asked a bunch of questions, and they were so excited to learn that there's this resource. I mean, they've said things like, if you're in a fight with your girlfriend, call us. If you're mad at your mother, call us. If you have a friend that you think's in crisis, you don't have to call the police. You can call them. 988 can't call the police. They're a de-escalation line. So if you call 988, but the person that's calling it's not going to necessarily know that, right? They may not believe it. But they can call 211 and get the information that way.
There are currently
I might be able to tell you more information.
callers
There's
ahead.
nobody here.
Press any key at any time to have us keep your place in line and call you back when your turn comes up.
While we're waiting, should we hang up or you want to wait? Okay. You understand though what I was trying to get at, and I apologize. But yeah. But now if anybody has, I'm basically done. I wanted you to hear about 211, and I apologize because that was not the exact conversation I was hoping to have, but they are extremely pleasant and will help you with anything. I have a nurse practitioner student from Yale who's working with a family of immigrants that had 5 kids, and they were putting them up in like a 1-bedroom apartment, and she couldn't find any help. 211 helped her. When we were on the phone, she asked that question about what resources. When I'm in a cab or an Uber, whatever you call it, typically I don't know, 100% of the time I've been in, they don't have health insurance. You can get health insurance. People don't realize this. You call 211, which is what I did from the airport out here. And this man was like so excited because he didn't know that there was insurance available to him. They see an ad on TV about so-and-so. There's so many people that don't know. So please share. Yes.
Question. One is, do they have translation services? Or they have to speak English to be able to talk to 211? Do they actually have?
No, they do not. They have, there was another prompt that you could press for the different languages. Anybody else have a question about anything? Yeah.
So as far as for a lot of the population we work with our company is older people, and a lot of them are widows. So is there services and that perspective to be able to help them?
Exactly. That's what I would say. When you're with a client, call them together on speaker. Help them through it because they're not going to want to call on their own. You wouldn't want to call on your own. Somebody had to actually call with me for me to get it. And I learned all kinds of things because I had somebody that knew a lot and I had a lot of questions.
Just if you're calling?
Yeah, when you call in, it'll say which zip code are you calling from, and they'll route you there. But you might be, they also say, like, if you're moving, let's say you found out you have to relocate, you can find out, you can be referred to the 211 in that state and find out whatever it is you need to find out. You know, I'm thinking about living here. Do they have public transportation? I was in a hit and run. And I called them to find out if there was like a pool of money that you could apply for your deductible. So she did research for me. I had a class where I knew one of the children were undocumented, so I didn't say anything when we were on the phone, but then I called and asked if there were resources for undocumented, and she sent me 3 pages. They'll email you. They'll do the research for you. It's like going to the library and going to the resource lady and telling her what you need, and then she does the research for you. 211 is the umbrella of United Way that holds every service in your state. And if you know people that have nonprofits or something that would be helpful, tell them to call up and they can get theirs registered. They have to apply. But that's another thing. You have to know that you could do that if you're a nonprofit too, right? So that's 211. And I think after this was my little graphic on 211, free tax help. And then I guess our program really has 5 modules. I gave you the Mental Health Toolbox, but in every single one of those, we make a live phone call. We call pharmacists, we call hospitals, we call patient financial counseling. I believe everyone should have the ability to navigate their own health and advocate for themselves. We can help them, but we need to help them help themselves too. I want to say thank you then. Thank you very much.